About 12 years ago, I got pregnant, and my doctor at the time told me that all of the leg pain I was having was just pregnancy. It was sciatica, no need to worry about it. And it got worse and worse throughout the next 11, 12 years. If I did some kind of activity, I would probably be paying for it for about 3 or 4 days with pain. And that's when I came to Dr. McPherson, and that's who found the source of all the issues was the L4, L5 movement.
When you have a problem where there's motion in your spine that's causing your symptoms, you need to have that motion stabilized to relieve your symptoms. And that stabilization requires fixation. We might try some physical therapy and maybe an injection prior to undertaking surgical intervention.
He's the one that suggested doing an epidural just to ensure that this is the root cause of the problem. Actually feeling what it felt like to not be in pain is where I signed up for the surgery very quickly after that. Dr. McPherson brought in an example and showed me my MRI results and explained to me that they would customize a form to fit into my spine to help with the surgery and explained the whole process to me. And it did make me feel very comfortable knowing that it was to form to my own spine.
The beauty of my spine is that it's made for that person. We take a literal copy of your spine and we make a guide that fits only on you.
When we think about my spine from a patient experience standpoint, I think it all starts in the office. You know, when I meet with the patients before surgery and we see this personalized model, it just lets things come to life for the patient.
We can obtain a CT scan before surgery and plan out the screws, make decisions about the screws, think about them. So it cuts down on the amount of radiation and time frame during the surgery because the guides pre-plan the trajectory that I'm going to take for the fixation. And so if I have a technique like my spine that allows me to be even quicker, it's beneficial. So in the ambulatory surgery center setting, it's a very specialized environment to deliver a specific type of surgery so that you can leave after one day and often leave the same day.
In the morning around 8 o'clock, I arrived at the surgery center and I was scheduled for surgery at 10:05. And I woke up from surgery around 2 o'clock that afternoon, got out of bed just to walk around, and there was no hip pain, no leg pain. The numbness was gone, and I was discharged about 6 p.m. that night. So in and out in about 10 hours.
So with Alethea, she was able to go within probably 4 hours of her surgery. It's not something we can promise, it's not something we shoot for, but it tells us that we're headed in the right direction with this technology. We're getting closer and closer to the ability to deliver that type of care.
Having the MySpine procedure has definitely changed patients' quality of life. They've gone from being completely miserable and excruciating pain to a complete turnaround.
I think I'm very lucky because I woke up without pain, and I have not really experienced any pain since. As far as activity levels, I am definitely where I want to be at this point. 3 months in, I'm able to work out 5 days a week again.
I think the MySpine technique works really well in an ASC setting, primarily because it makes the lumbar fusion surgery much less invasive. This technique benefits us because it gives us a patient-specific guide. You know, it gives us another layer of security as we're placing the screws, and it allows us to match it to what we're seeing both intraoperatively and on the radiology findings.
It's always nice when you're doing a procedure to have things be routine and to not have anything out of the ordinary. And it's really made that the standard.